My name is Dr. Dilip Panikar, and I'm the lead senior consultant in neurosurgery at Aster Medcity, Kochi. Today I will be talking to you about a procedure what is called deep brain stimulation. Now, deep brain stimulation essentially is a procedure that implants an electrode or a set of electrodes into the brain, which can modulate the function, which can alter the function of different parts of the brain. And this is a procedure that is used for various conditions. Most commonly, it is used in Parkinson's disease. Now, Parkinson's disease is a slowly progressive condition that affects a large number of people, whereby a chemical in the brain called dopamine comes down, and because of that there are all kinds of effects. These people can present with slowness of gait, with shivering or tremors of the hands or the legs, slowness of movements, and a whole lot of other conditions which is slowly progressive. It is largely treated by medicines that helps to replace or try to replace a chemical that is less in amount in the brain. But in certain situations, especially in advanced disease where the efficacy of the medicine comes down, the procedure of deep brain stimulation can prove very useful. Now, apart from Parkinson's disease, deep brain stimulation is also very useful in other kinds of movement disorders like dystonia or abnormal twisting movements of the body. It can also be used for certain psychiatric disorders like severe depression or an obsessive compulsive disorder, or in some kinds of addiction. The other uses that have been stretched include certain kinds of headache or the behavioral disorders. Now, what is deep brain stimulation as a procedure? Now, like for certain cardiac disorders where there is an abnormality of rhythm, a pacemaker can be implanted to control the rhythm of the heart. In the same way, this device is also kind of a pacemaker that can deliver a small current to certain specific parts of the brain and can alter the function of that part of the brain. Now, this device, the pacemaker, or what is called the IPG, the implanted pulse generator, is implanted below the skin, just below the shoulder, most commonly on the left side. The connections, the electrodes, are taken up below the skin, behind the ear, and they are brought out into the head, where through two small holes that are placed in the bone, these electrodes are placed deep into the brain in the specific targets that have been pre-selected based upon the disease condition for which it's being done. Now, this placement of the electrode is very, very sensitive and has to be done in a very specific way and very accurately, and this is done by a procedure called stereotactic surgery. The whole process is monitored and controlled by very high resolution MRI and CT images that help us to determine the position of the electrodes or where the electrodes have to be implanted. And also during the implantation procedure, the neurologist continuously monitors the patient to make sure that the desired effects are obtained and there are no ill effects. When done in the right patient, deep brain stimulation can prove extremely effective and can bring about a very, very good, or sometimes even a remarkable transformation in the life of the patient. Allows them to get back into a functional state, reduce their dependence on drugs, and allow them to lead a normal life as far as possible. Thank you.